Thank you, gentlemen, for being here today. Let me just start with Captain Jones and Rear Admiral Tote. Pronounce your last name for me. Is it Tote? Thank you. My understanding is, after talking with our Washoe Tribe of Nevada and California, and what I'm hearing from many of our tribes, is that tribal-specific funding streams to address the opioid epidemic in our tribal communities that was not included in the 2017 state targeted response to the opioid epidemic grants. Is that true?
Correct. So the statute basically limits eligibility to states.
So don't you think there should be targeted grant funding to address these issues in our tribal communities?
We certainly would be willing to carry forward however Congress appropriates those dollars or authorizes those dollars.
Are they needed?
I think we've described today that there is a substantial problem in Indian country, and we've taken as many flexibilities as we can to.
I'll take that as a yes. All right. And then my colleague was talking to you about a culturally appropriate treatment, and I believe in it. I think not only do we need culturally appropriate, but we need trauma-informed treatment as well. Can you talk a little bit about that, both of you? Do you provide trauma-informed treatment as well when we're talking about substance abuse needs and treatment in tribal community?
Yes, ma'am. We entirely support trauma-informed care. It's very important to get to the root of the problem. So many patients that are seeking relief from opioids may actually be suffering from untreated mental illness. They may also be suffering from economic disparity. They may be suffering from historical trauma. They may be suffering from a lot of issues that came up through childhood as well. And so having an understanding of a person's background and a person's culture, where a person is coming from, is very important to being able to effectively bond with them and to make a connection and to deliver effective treatment.
Thank you.
I'll just add on our grant programs, I think trauma-informed care and the importance of addressing co-occurring substance use and mental disorders are infused throughout our grant programs.
Fantastic. And Rear Admiral, do you have the resources you need to provide that level of care?
Appreciate the question. The IHS wants to be responsive to tribal concerns, and I have heard from tribes that there are not enough resources out there. Certainly any funding that Congress can provide will definitely be appreciated.
And I also hear from our tribes that it is difficult to get that treatment because they don't always. I've heard a lot of conversation about working with our states, but the states already tapped out trying to find that treatment that they need for substance abuse within their states. So then requiring our tribes then work with the states to fight for that money as well is a little difficult. It makes it much harder to get the resources to our tribal communities. Wouldn't you agree with that?
I think that's really the importance of the STR funding and other training and technical assistance that we're applying broadly across the U.S. and even specific to tribes around training and technical assistance is to build the capacity. So we could have, multiple billions of dollars that could be spent on treatment, but if we don't have providers who can provide that care, whether you're in Indian country or not, you're not going to be able to get access to evidence-based care. So that is really a core part of the work that we're doing, is to build that foundational capacity.
And then would you agree that a special behavioral health program for Indians that parallels the structure of the existing special diabetes program for Indians to provide substance abuse prevention, intervention, and other needed behavioral health services might be an answer to addressing these needs of substance abuse needs in tribal communities? Do you think the diabetes program is a good model to emulate?
Thank you, Senator. We absolutely think that the diabetes program has been an excellent model. Emulation of that funding model is something that we have heard from tribes, and yes, it's an excellent idea.
Thank you. And then one final question for Mr. Anderson. Thank you for everything you do. First of all, I do know you, U.S. attorneys, AUSAs, and U.S. attorneys across the country are working very hard in our tribal communities. You're tapped for resources. I know that. I will say that as somebody who worked in my state in law enforcement. Let me talk to you about this. This came up, Chair Hoven asked you about this, the impact of moving HIDA out of the Office of National Drug Control Policy. Can you talk a little bit about HIDA and how important those grants are and how effective HIDA is in our communities?
Senator, HIDA is certainly an important part of what we do in the federal partnership, focusing on those high-intensity drug corridors throughout the country. In terms of the structure of HIDA or its funding, that's not something I can discuss today, but I can tell you that they are, from a federal law enforcement perspective, a critical aspect of our efforts to interdict the flow of illegal drugs, including opioids, heading to and that end up in our tribal community.
Thank you. Critical and effective.
Yes.
Correct? And then let me just say this. We are combating opioids now, and it is a crisis across the country. 10 years ago, it was methamphetamines. It's black tar heroin. I can promise you that we are going to, unless we address this through treatment, unless we address this through dollars and fighting, not just assuming that law enforcement's going to do it all, we are going to see constantly this shifting from methamphetamine to black tar heroin to opioids in our communities. It's something that is a scourge that we need to address. And we have to come together on the treatment side and law enforcement side and adequately fund it in all of our communities, including our tribal communities, really to really combat the crisis that we have across this country. So thank you.